This afternoon, pregnancy and that postpartum period are a time when women are susceptible to mood disorders like depression and anxiety. Add to that the COVID-19 global pandemic, and that's a lot of things that can really factor into a woman's mental health. Fox 13's Kelly Chapman spoke to Intermountain Healthcare about when to seek professional help.
Pregnancy can be a time of excitement, but for many, one that comes with extreme nerves and fears.
With a high-risk pregnancy, naturally comes a lot of just anxiety.
NATALIE Johnson lived with that stress, categorized as high risk. She and her unborn baby had to be put on bed rest in the hospital for the last 2 months before delivery.
Dr. FELTOVICH told me that I would be staying for the rest of my pregnancy. She said that was a really hard thing for her to tell me because she knew how difficult it would be to stay here.
And it wasn't just the long hospital stay that was the concern. The current pandemic would keep visitors away.
I wouldn't be able to see my kids, have my kids in my room.
Including her own family.
The loneliness of being there.
Another big concern for pregnant women is peripartum mood disorder. Feelings of sadness, depression, anxiety, and obsessive-compulsive disorder, both during and up to 12 months after delivery.
The risk of peripartum mood disorder is actually on the order of 30 to 50%.
Dr. HELEN FELTOVICH with Intermountain Healthcare says when the baby blues last or start interfering with everyday life, it's time to seek professional help.
There's help available. It just takes a phone call or mentioning something to your caregivers.
And right now, more than ever, people are feeling the pressure.
When you add a pandemic on top of that, where everyone is feeling the effects of social isolation and everyone is concerned about germs and staying healthy, it just can get really compounded.
For NATALIE, she and her baby are healthy and well. Thankful to have the support during their hospital stay and postpartum period.
I think the nurses made a special effort to spend time with me in my hospital room. They became my friends in the hospital, and I really appreciated that.
Kelly Chapman, Fox 13 News, Utah.